Yeah, I started the process I actually hadn't been a member. So I went and I kind of to a meeting and scoped it out in November of 2018, just to see who was in the room and kind of, we have a small state, so I knew some of the people, and to try to imagine what the issues would be. And then I submitted a proposal, a resolution that June. Is that your timetable too?
Yeah. So we just finished like submitting resolutions, and then they're voting on like the each section is voting on if they're going to endorse resolutions right now.
Yeah. So and at that meeting, the November meeting, when it was voted up, was supposed to be voted on, it got hijacked, and because of Robert's rules, which I wasn't on top of the game of Robert's rules, it just didn't even get discussed. And it was kind of obvious to the people in that room that it had been hijacked. So then they were conciliatory, the staff and the leadership, and they said, okay, we'll work with you to present it. And so I submitted it again after joining a task force where they definitely wanted the principles they stood for in the resolution. So it would be logical. We stand for these principles, therefore we support single payer. And I hadn't thought about that, but in the end, I think it really added to the resolution. We have a few principles that specify things, you know, like global budgets. And then it was passed this November. So it was a long process for things that are preventable, I think, for others. And I'm wondering if you could change the wording so that somehow just change the wording of single payer. Could you do that? Or in the beginning, I talked about Medicare for all, and I thought that that was not a good thing for physicians because they have so many negative feelings about Medicare reimbursement. So I use the word single payer, but do you think it's actually those words that are off-putting to people?
Yeah, I'm not really sure because it's kind of weird. I haven't really had an opportunity to have like a group discussion with people in the organization so far. It's been like very, it's, I don't know, it's like almost you have to go through the medical student section before you can go to the PA Med group as a whole. And then because of like COVID and stuff, we've been having these like virtual meetings, and there's just been time for votes, not for discussions.
Wow.
So
So it did pass the medical student section.
They're voting on that next weekend. Yeah.
But you're optimistic.
Yeah. Very optimistic.
Yeah. And do they have full voting at the State Medical Society meeting?
I believe so. I'm not exactly sure how it all works out. I think each section gets like 1 or 2 votes or something. But I know that there's like a lot more votes than just each section.
Yeah.
I'm not exactly sure how it all works out.
So I guess I would say it's very important to learn all these things, because this isn't just, you know, it's a wonderful concept and would be good for everybody. It's politicking. And I think it's very important to know how your medical society works, how many votes, who has votes, how people get votes. Just, I would learn all of that kind of tedious stuff.
Yeah.
Because it is politicking. And even in our sweet state of Vermont, where people are kind and sweet, there's a lot of politicking. So that would be a recommendation, to know exactly how it works. So you've submitted, you have to submit the resolution.
It's been submitted to the medical student section. we had a meeting just yesterday to like go over the final submissions, and everyone seemed pretty pleased with it. And then yeah, this
So
next
I'm sorry. So that's the one that's being pared down, and
yeah.
I see. So if they're supportive, why are they worried about using those words?
I don't really understand it. What I get from the leader of the medical student section is that they don't want to put like effort into something that doesn't have like a realistic chance of passing.
I see. Well, then I would take that on full force, because I think that's huge nationally amongst physicians and lay people, that it's just too big, too complicated. And I guess I would develop a response to that with passion. I see Susan Rogers is on. I think she said it just like we have to say it, that polling has shown that a majority of physicians support single payer. But most of our professional associations that claim to represent us do not support it, and they're the ones that are shaping policy. And we have to take back, those organizations so that physicians can really be represented on a national level. And talk about things that when Medicare passed in 1965, Wall Street had dire predictions about what was going to happen. When marriage equality in Vermont, before it passed, people said it'll never pass, forget it, and it passed. So before things are passed, people predict that there's no way we can get it passed. So some kind of inspirational way of communicating that we have to follow with perseverance what we believe, what we have to learn to be visionary and see what we need as a country and pursue it. Because I think a lot of the incrementalists use that argument, and it's just very detrimental to our cause.
Yeah, that's super frustrating.
So I would really try to, people have written on it, and it's a big thing that has to be overcome. And I know I had the opportunity to present at various, there was a council meeting, there was a membership meeting. It was only 2 minutes. I had to be very tight, but I communicated that kind of thing. Like, let's be honest with our feelings. We know it's and talk about that it's only because of messaging by insurance companies and pharmaceutical companies that we don't have this, because it would make sense for everybody. And physicians know that. They have that experience, and talk about how our messaging has to be different and empowering, and talk about all the little clicks that we make as physicians, and the classes we go on, billing and upcoding and all of that. And we've accepted it, and we have to stand up and show, build up our morale and take medicine back into our hands. And we can do it. Canada did, other countries can do it. So I guess I would just harp on that.
Yeah.
But take it full. Don't retreat from that. Take it full on.
You were talking about issues folks have had with Medicare, but I mean, plain fee-for-service Medicare polls as the most favored or least unfavored payer in the AMA survey year after year after year.
Mm-hmm.
And we also had the experience in New York recently, the bizarre experience where one of our hospital association groups, we have basically two for New York State, one for Greater New York Metro and one for rest of state, neither of which supports New York State single payer, but they actually ran an ad basically against the insurance companies. This was an internal battle going on in New York State on reimbursement, but they basically ran an ad that we could have written against the private insurance companies on, their policy to the hospitals of denying reimbursement, delaying reimbursement, and reducing reimbursement. Deny, delay, reduce was their campaign. And in it, they made the explicit comparison to plain vanilla Medicare as the best, as being the best thing ever. And then they turn around and oppose the New York Health Act. You know, and partially it's because they're boards of directors. I mean, even though they're all not for profit in New York State, in ostensibly for IRS purposes, essentially, a lot of them act as for profits. The boards of directors are filled with Wall Street people of the worst sort. So their executives are limited to what they can say. And it's at least one, as our leading assemblyman put it, leading single payer support assemblyman in New York State put it, the only reason you can think of doctors and hospitals opposing single payer is Stockholm syndrome.
Is what?
Stockholm syndrome
Uh-huh.
was the way he put it.
Uh-huh.
You know, that they just can't even conceive of a better way.
Right, exactly. And we have to put that into
Yeah.
people's minds. They have to have that vision of what it's like. And it's just so easy because it's right up, you know, up north of us.
So I came to this because of the beginning rollout of the PNHP's campaigns for medical society endorsements, and also the attempt that had been recently made for my academy, the American Academy of Pediatrics, for a national endorsement, which apparently got waylaid. That ought to be pediatricians ought to be low-hanging fruit,
right.
you know, compared to, say, interventional radiologists. So I didn't know if there was anything that we have on that. I mean, the New York State Academy of Pediatrics has endorsed and has been a long time endorser and re-endorsed the New York State bill.
Yeah, I agree. I think that that's a very winnable battle. I'm a pediatrician. I was a pediatrician. And the pediatricians in Vermont were a big force in voting for this. I am a member of the academy, but I haven't heard of this. So maybe we need to, you know, it seems like increase the organizing effort and reach out to people.
Can people who are more aware from national because the lead on it was somebody who's not on this video, the brief lead for the AAP campaign.
I know it failed with the family physicians. There was a resolution put up a couple of years ago.
Yeah.
And that was voted down, but I don't know what happened to that.
Yeah. And again, in New York State, the family physician group has endorsed the New York State single payer.
Mm-hmm.
My wife's family medicine, they are the ultimate in bimodal distribution of politics.
Uh-huh.
You know, there's a lot of conservative family docs, you know, Marcus Welby onto MAGA, if you will. And then there's sort of the lefty.
Yeah. And it's who it comes down to. This is what I was referring to, politicking. It comes down to organizing the people that you know are going to vote yes in that final moment. And I was hoping to get a list of Vermont Medical Society members, but I was unable to do that. But if we can send messages out to people who are voting, that's critical. And I was saved because our meeting that did vote up the resolution was virtual. And people don't want to trek up to Burlington, people I know, for meetings to vote. And virtual meetings can include people who don't want to go to those, you know, endless meetings. So some of it is making the people that you know are going to be your supporters be there when the actual voting's happening.
So I guess it was Robert Vinetz who was leading the charge.
Vanessa?
Vinetz, Robert, one of our, was leading the, yeah, this was from Caitlin back in June, not that long ago.
Mm-hmm.
And then it got canceled. I don't know exactly where Robert is based or if you know him, but he was he was taking the lead for PNHP in trying to get this resolution through.
Well, why don't both of us contact him. I'm excited about taking that on, and figure out how it works, how those, just trying to figure out who are our allies and what the mechanics of it. That sound good?
Yeah, that's his email from the original thread. And he's in California.
Super.
And Jonathan Koch in North Carolina was, I mean, we had a bunch of us that were on this group that National had identified. But then it, for whatever reasons, and I think it was exactly the kind of stuff you're describing in terms of like the Robert rules, you know, some people were opposed to it, found technical
Right.
Ways to keep it off
Mhm.
the agenda.
Yeah. But that's all overcomable with just some homework.
Yeah.
I think we don't like to think that that's the important battles, but in the end, it's important. So, yeah.
I am just copying and pasting the contacts that Caitlin had provided for the, like, other people from who are AAP members who were originally identified, in addition to Robert, who's taking the lead at the time.
Yeah, I think that would be powerful if the AAP did that.
Yeah.
Yeah.
So that's that list.
Other questions? Kay, I see you're on the call here.
Hi.
How's Kentucky doing?
Oh, we're in the middle of this preparations for this July 24 March for Medicare for All. So we're working hard and it's going very well.
But what happened to all the people who were interested in submitting a medical society, state medical society resolution?
Well, I think what happened was that Dr. Shively actually submitted a resolution, but it's not a single payer resolution. It's for ending discrimination against those with pre-existing conditions in the Medigap plans, which is good. I mean, I think he has that in and that it's ready to go, but I'm not actually certain. I haven't been able to talk with him, but we couldn't find someone who had both the willingness and the ability to go after the single payer resolution. I wish it were so, but.
Yeah, it's a pity because there were a few people who didn't know each other that expressed interest, and I was encouraging them to work.
Well, I think that one woman who probably was in touch with you has submitted something, but she didn't share it with me, and I'm not sure what it is. So I really don't know. I don't know what she submitted.
Yeah. So other questions? Steve, Donald? I'd be happy to work with you, Donald, in any way as it comes up. It's very nice to have, you probably have a group in your medical student group, but
so I guess I'm just wondering, how did you find out? Did you have like someone in the organization who helped you figure out all of their kind of, I guess, institutional rules as far as how many votes you need to get for this and stuff like that? Because I've like read through this stuff online, but having a hard time like deciphering the actual.
Yeah. Well, in Vermont, because it's small, we have one medical society that everybody's a part of. We used to have county, but we don't have county anymore. So I learned after I was ignorant the first time, it was fairly easy for me to learn. I have a Robert's Rules cheat sheet that I went over, but I had already been burned on that. So I learned that lesson deeply. And I became friends with the staff. I can't say, I tried to be cordial and polite with the staff, because I think the staff can wield a lot of power about what's brought up and what doesn't. And I ask them questions in a friendly manner. So it is easier in Vermont. And I actually didn't realize how complicated it is in other states. When I was speaking to this physician in Kentucky, she explained how there are several, I guess, county or metro, and then you take it. So there were many more steps in other states. But yeah, staff members should be able to, if you ask in kind of a, let's work on this together, because I think the medical society is wonderful. They should be able to answer your questions.
Okay.
Yeah, like give me time. I mean, I had to say, what exactly is the deadline for submitting the resolution? When does the council vote on it? Can I be at that council? How many minutes do I have to present? I think it builds your confidence, and you're not hijacked in the end if you know all of those things.
Okay, those are definitely good questions for me to ask.
Yeah, and it's nice that you have it. I bet amongst those medical students who tend to be more progressive than older folk, you have some allies there. So if you ever get to a meeting, it's important for other people to know they have to speak up in favor. There's a certain momentum that's generated when you bring up a resolution, then other people support it. And in fact, in the final membership meeting where we won the vote, I presented, somebody said something positive, and there were like 5 positive statements right afterwards. And that was important, and then there were some negative things, but it had already, I didn't feel alone. People didn't think that it was a kooky idea. There was a presence there that I think was very important. So your medical students should be charged. Maybe you could even tell them or suggest what you need in support. Yeah, I wouldn't compromise. I'm not sure it's worth the effort to come up with a resolution that supports incremental change. So
There's other people to work on that.
Yeah. So what are other things that have come up? Corinne, welcome.
Thank you. I'm in England right now.
Oh, how blimey.
I've been working with the California Medical Association. It's tough.
Uh-huh. Yeah, tell me what happened. I heard the resolution was voted down there.
Many times, different ones, many times.
And could you tell us what happened?
Fred, I'm so curious. You say it's tough. Can you tell us?
Well, it's a very conservative organization. As Hank Abrams said, it's a trade organization. And the leader, the CEO, has been very opposed to single payer. And that is what sets the tenor of the whole House of Delegates, which is when resolutions are voted on. Actually, now CMA has done a lot of electronics. So I get a lot of support. A lot of people write in that they support it. It comes in different forms. We've said, go for single payer, study single payer. They've all been either gotten close, they get reviewed by a council, and then either it gets compromised quite a bit, but regardless, it just then gets rejected. And then I tried setting up a member interest group to get a whole bunch of people within the CMA that are single payer advocates, because people are very timid. It's very intimidating dealing with the CMA. And that was knocked out twice. It was seen as very, very threatening. So my next step is to try to set up a chat or some kind of email group outside the CMA and get people involved in that way and start building a base that way. But it's interesting. I know that we're moving. because initially at first single payer, you couldn't even say the word, and now they're sort of looking at it. We actually had 1 year at the House of Delegates, we had Peter Arno they invited Peter Arno to speak about single payer, but unfortunately it wasn't a very good presentation. And the person that he was debating spoke to with no facts, but spoke to very emotional fear. And it was near the end of the whole session. And so people just voted down single payer. So it's really in flux. All I can say is it's in flux. It's like moving the Titanic an inch at a time, but it is, as I can say, it is moving.
So just structurally, is it the House of Delegates that does the voting, or is it the general membership?
It's the House of Delegates. What happens is it's either at a House of Delegates meeting, which is once a year, or it's introduced as a resolution, a quarterly resolution where you introduce it, then there's commentary, then a council looks at it, then it goes back to commentary, and then it's voted on by the Board of Trustees, I think. I'm in England, so now I'm a little confused as to the whole process. But unfortunately, there's less debate now with this quarterly resolution that's done by electronically. There is a in-person House of Delegates meeting coming up in October. And then unfortunately, I'll miss the PNHP National Leadership meeting. I'm really upset about that, but I figure I better go as a delegate to the CMA and keep pushing. And probably we'll try to see if I can introduce another resolution for single payer again. I usually work with.
Who are the delegates? It sounds like you are.
Delegates come from the various medical. Pardon?
It sounds like you're a delegate, yes?
Delegate. It comes from the local medical societies all up and down the state. And then there's a medical student delegates, there's residence delegates. What's interesting is with the medical students tend to be quite progressive with all sorts of good resolutions. But once they become residents, it's a much more conservative organization for some reason, delegation. Then, so there's specialty, geographic, medical students, residents, young physicians. So I forget how many there are total, in the 20s, and they all have their own delegates. So I'm a delegate from my district, which covers the Northern California from Santa Rosa up to the border of Oregon. But that's the way you need to become a delegate in order to really get active in the CMA. And you have to become a delegate where you live. If you live in Los Angeles, you become a delegate from the LA Medical Society, but you have to sort of work through your way within that local organization.
And is your feeling that the way to get the House of Delegates to vote is to work with those people or to organize the general membership?
Or work with those people mostly. Even though the delegates are supposed to represent the general membership, really the voting takes place within the delegates and alternate delegates. So now Kathleen Healy is now another delegate within my district, and even and Art Chen is a delegate from Alameda. So just 3 or 4 people makes a difference.
Right.
Hey, Corinne, I have a quick question for you. How do you become a delegate?
Good question. Who's speaking right now?
Hi, this is Caitlin Gilbert from the national office.
Okay, so the way you become a delegate is you get involved in your local medical society. So every county or 2 or 3 counties has a medical society, and you start working. I always say get to know who the executive director is. And I have a very supportive executive director. She sort of pulled me into the whole delegation, the CMA delegation ladder. But yeah, so that's what I recommend. Just get to know the executive director of the local medical society. I don't know how the specialty ones work. There's solo practice, large practice, medium practice. I don't know how they work, but you can find someone, you can look them up and see who the delegates are and then contact them and see how that goes. But you have to get elected, sort of.
And did Kathleen and Art become delegates for this issue?
I became a delegate for this issue. Other people become delegates because they like being delegates or they're involved in
Mhm.
the House of Medicine or whatever. People become delegates for all sorts of reasons.
Mhm.
Yeah.
The
I mean,
only
I
reason
think,
to
go ahead.
single payer.
Yeah, I mean, I think one of the things we've suffered from nationally and locally is all of the progressive doctors don't join these organizations because the organizations have been so conservative historically, and then it becomes a self-fulfilling prophecy because we're not members.
Right.
Correct.
You know, I mean, if everybody was a member of PNHP, joined AMA, we could probably make enough delegate difference at the national level.
That's true. And actually, you can be a member of your state medical association in California and not be a member of the AMA.
Yeah.
So I'm a member of CMA, but I'm not a member of AMA.
Yeah. And, you know, we know what the students there were able to do within
Right.
the AMA delegates the other year.
Right.
Yeah, we've been having to fight with the Medical Society of New York, similarly, where we have a couple of counties that are supportive. But again, I mean, and we've got two members locally who've been working on it very hard for years. You know, have chipped away at sort of the, you know, get rid of the negative language, but not up to an endorsement yet.
Mm-hmm. Yeah, it's a slow process. And I mean, I keep thinking, you know, it's so frustrating at times. And I keep thinking, why am I doing this? But I don't want to be elitist, but I know that anytime any kind of universal healthcare program has been passed in a country, it has required somehow by hook or crook physician support. You know, and when the NHS was passed, it was because the politician, what's his name, Nye, whatever, he made deals with the Royal Medical Society. When Lyndon Johnson got Medicare for 65 and over, it's because he tricked, you know, the AMA, I think it was the AMA president, I'm not sure, but you know, we need those, unfortunately, we need these organizations to stand by because they are very powerful lobbies in their state legislatures. And the AMA is a very powerful lobby, unfortunately.
Yeah.
Yeah.
Corinne, do you think one strategy would be to try to get people you know to become delegates?
I have tried, yes. And
Oh, so you're doing that. Mhm.
the co-chair of PNHP California, Dean, did actually join and became a delegate because there were openings, and she's sticking with it, which is great. But it's slow, you know. And there's like one person in LA who's thinking of it. I mean, it doesn't take that many. And I heard that the person who's going to be maybe the president-elect of the LA Medical Society, which is pretty powerful, went to a PNHP meeting. So I'm going to contact him. There's been some slow movement. It's interesting, and that's all I can say.
Yeah. Are there issues that people bring up that you don't know how to answer, or is that not the issue? It's just that,
No, one of the big issues is that doctors don't like Medicare.
right?
You know, because of regulations. And that's, you know, when you say Medicare for all, it's a red flag for them. And I'm
Yeah.
sorry if I'm repeating stuff you might have that came on late.
No, I found that also. So I didn't use Medicare for all when I speak with physicians. I use SinglePayer. But I also think that one of the principles that was in the Vermont resolution can appeal to that, and it calls on collective participation by physicians in rate setting. You know, we can say the AMA's role can be to help rate setting, to show that we're going to change that part.
And I mean, I've said the CMA could represent the physicians in setting these rates. I mean, it puts them in a really good position. I mean, it only helps physicians. It's interesting, one of the more conservative groups who are opposed to single payer are the solo practitioners, and they would be the ones who would really benefit from single payer. So there's just a lot of misunderstanding.
Right, exactly. That came up in Vermont from solo practitioners, and we had to bring up that actually our accountable care organization is right now is the organization that's being cruel to solo practitioners. And in Canada, I heard about 95% of the physicians are in private practice. So these are myths, I think, that can be debunked. I found that a lot of the questions that came up, a lot because of the PNHP website and other readings in various journals, are all answerable. And I felt very confident that if people were honest and open, that these questions were easily answered.
Yes, it's, you know, I mean, I think California, you know, it's it's a lot bigger than Vermont, and
Totally.
it's a lot
Yeah.
more diverse.
Yeah.
It's interesting this year, the way House of Delegates has been changed is they have an educational, and this year they're talking about racial equity, and they've set up a special committee with quite a bit of authority to deal with that. And so that's one topic. And the second topic is the corporatization of medicine. And they've gotten speakers, none of which I recognize. I don't know if any are single payer advocates,
Huh.
but they're recognizing now that medicine is corporatized. But I don't, you know, the solution is this hodgepodge of little bits and pieces of patching. It's crazy,
Right.
just crazy.
Yeah.
So no, I'm trying to find out more about the speakers and whether I can get somebody. They'd like somebody from California to speak to the issue of corporatization. I don't even know if I can get somebody in to add to that panel.
So
Yeah.
I have some connections for, sorry, my video's gone out. I have some connections, you know, there's a national movement, that's got some inside the beltway at the national level, traction on anti-monopoly and anti-private equity. And they are aware of, healthcare as a leading area where that's been a problem. And I've suggested to national, we should be making some stronger connections with those groups.
Do you know any good speakers who live in California?
No, I mean, the ones I know are based in DC. The ones I know of are based in DC. One of them moved to Brooklyn. But unfortunately got a job with private equity. She claims it's a good one, but you know how that goes. But yeah, I'm trying to, unfortunately, I'm having some tech problems right now. I'm going to log out and log back in. My apologies.
Corinne, it sounds like you're doing great work, and it sounds like
a mosquito. That's what you know. I just keep buzzing in at these meetings, and I mean, it's almost when I start thinking, many people roll their eyes, but too bad.
yeah. And maybe changing the people at the table would be helpful.
That's my next step. Get a hold when I get back from England is to get a hold of the people I know that are somewhat sympathetic to single payer and just start a little group outside the CMA, you know, beyond the CMA platform.
Right.
And I know some of them are delegates, and to say, you know, come, you know, let's come together at this next House of Delegates meeting in October.
Mm-hmm. Yeah, and I guess some membership input to show that this is what our membership wants, tapping into any kind of positive single payer support. Yeah.
Yeah, there's 40,000 members. And unfortunately, some of them they're automatically enrolled. I worked for a tiny little Indian health clinic, and they automatically enrolled me when I first started, and I didn't want to have anything to do with it. And as I said, the executive director sort of pulled me in. But for instance, Kaiser doctors are all, the membership to CMA is all paid for. That's a lot of doctors.
Uh-huh.
Other health is also, and these are big organizations that are very opposed to single payer. And most of the doctors who are members aren't even involved in any way, shape, or form. They just happen to be members,
Right.
and that a strength, you know, and lobbying. But they, unfortunately, one of them, Sutter, got a seat at the table of the board of trustees, and it's like, oh God, this is not good.
Mm-hmm.
Because I don't know who's
in general, are Kaiser, would you think Kaiser physicians, are they all over the place, or would they be supportive, just the regular members who are not active?
I think there's some that are supportive. I doubt there's many that are totally against, but many of them are just not involved. Now, I know in Northern California, there's a group of residents and physicians who started a whole petition to get more equity. They didn't put single payer in, but all the things they requested would be, of course, dealt with under single payer. And there's an internist who's working with them to, you know, make them understand that single payer really would address a lot of their concerns. It has to do with, you know, even Kaiser, some of the employees who are not in the upper echelons, like the doctors and nurses, but the housekeepers and whoever else can't even, you know, get their own Kaiser insurance. So, you know, it involves, you know, getting them enrolled. But no, I mean, Kaiser has 3 arms, as you probably know. It has the insurance arm that's very, very opposed to single payer because they make tons of money per quarter. And then there's the hospital, which is neutral, I guess. And there's the doctors, which is neutral. And I know people in the state are trying to work with doctors within Kaiser to get them more involved. But how they get involved, it's a frustrating, you know, sometimes you go, I would much rather work with a group that's very supportive and just keep expanding versus this obstreperous organization.
Yeah, yeah,
I know.
yeah, it's
Master
thankless, but I thank you.
Yeah. Did you know Michigan passed a resolution in support of single payer in like 2014? It was a while ago, but I never heard anything after that.
Wait, Michigan State Medical Society?
Yes, I think it was 2014. I sent the information to Caitlin a while ago. But I never heard, I mean, I've not heard anything since.
Huh.
No.
Mhm.
But
You know,
thank
in
you.
Vermont, there were 2 resolutions that passed. There was the single payer one that I submitted, and then there was another one that kind of said, we'll support any incremental reform along the way. And in the beginning, I said, oh, that's horrible, you know, to have that. And
Unfortunately, you're frozen.
oh, I'm sorry. Am I frozen to everybody?
Mm.
You're clear on my end.
Let's see. Is that better?
I mean, you're clear on my end still.
Oh, okay. Maybe it's the London transmission. I just wanted to say that in the beginning, I opposed having a second resolution for incrementalism. But in fact, in the end, it wasn't that important because we could publicize that, you know, the Vermont Medical Society did indeed come out in support of a good resolution, even though the second one was, you know, kind of mushed the issues all together. So that would be another thing that I would recommend if it comes down to that, if there's a separate resolution in favor of incrementalism, not to spend all your time defeating that, but rather just pushing the other more positive. I guess Corinne isn't on anymore. But Steve just sent some good links here.
Yeah, so this American Liberties Project and the Open Markets Institute, if you look at who they are and some of the speakers and forums and materials, it's good. And they are actually getting some traction. I mean, you know, when I don't know if you follow some of the things around IT monopoly and telecom monopoly, and some of the actual positive things that Biden has done in that area. Some of those, you know, sub-cabinet level staffing have come from these folks. And
Super.
I've sort of put together a whole list of things about, frankly, it's in a way pessimistic because I think we've actually lost ground in terms of the strength of the opposition from the Wall Street side, that we've gone from a layer of, let's say, for-profit hospitals and for-profit insurance companies that at least were only 1 degree separated from healthcare to sort of the meta financialization of everything, with private equity taking over more and more, and in a way that's less and less, that's more and more remote from healthcare. The analogy is sort of Toys R Us didn't actually go out of business because of Amazon. Toys R Us was actually making money with their storefront toy stores. They went out of business because they got taken over by venture capital and were sold off. They were more valuable for the real estate and parts, as it were. And that's why they went out of business. Anyway, the for-profit sector has actually taken over more and more of healthcare
Yep.
in the years that we've been around. It's just gotten worse.
Yeah, and I think docs in clinical practice are feeling some of the repercussions of that. Just with productivity, stressing, and other things that physicians are required to do. So I think that pointing that out can be beneficial to our work.
Jane, I have a quick question for you, and it's about the language of resolutions. I actually took a look at that Michigan Medical Society resolution, and it's a little bit of a roundabout way of them saying we're going to create a task force for $1,000 to research single payer so we can draw conclusions on it. I guess the question for you, how do we prevent societies from taking up these resolutions that really say nothing, that really commit the society to do nothing in support of single payer, and really make sure that the resolution has meat on it? How did you work hard on that? Because I know the Vermont resolution is strong.
Yeah, well, interestingly, after my resolution wasn't even discussed the first time I brought it up, they set up a task force and they loaded it with people who were in favor of incremental reform, who didn't really do any homework. And I was there, I was ready to do everything the staff wanted me to do, write all the principles and do the homework. And then it was disbanded because people didn't think we could come to anything. I think it was great. I'm realizing that Vermont is different, not only maybe in the culture of the physicians that are here, but just the general membership gets together and it is at least structurally able to voice their feelings. So there was a survey of all the members to say, how do you feel about this resolution? And it was overwhelming. I was kind of surprised, happily, that it was over 2-to-1 in support of single payer. And I think that the leadership had to recognize that there was general membership support, and tried to introduce another resolution to kind of take the meat out of it. But that resolution did have membership support, and it passed. And some of it was making sure in the end that people who I know were supporters actually were there for the vote, which is kind of the ugly thing, the politicking I referred to. Yeah, I would say a meatless resolution is not worth effort, and yeah, it can be very disheartening, and I can appreciate the work that other people are putting into it. But persistence, I think I was persistent every time they tried to water it down. And Corinne certainly has been persistent. I appreciate that.
Along the lines of politicking, how did you round up support with different members in the organization?
I think there were some people who were definitely against it, you know, because of their positions. There was the chief medical officer of our accountable care organization, who's just, you know, clearly has defined his life as not a single payer advocate. Sometimes answering questions of, well, other countries have insurance companies, and kind of explaining how those are very different kind of entities than ours. But mostly, I think addressing this, why work on something that's not going to pass or never is going to happen? And this was even before the elections, when people were kind of, oh, we have to be cautious because we'll have Trump for some more years. Just kind of what I was telling you before, like encouraging people to see the vision of what could be and what does exist in other countries, and have the stamina and the spine to put their names down as supporters of something that we all know is what we would benefit from.
Yeah, so like beyond the talking points, just like the nitty gritty of like, did you just set up meetings with sections independently, or was this all at the big?
You know, I didn't. I presented to the council, which is the smaller group that weighs in on it, and I answered questions. And I think the leadership of most of these organizations is more conservative, and the people that speak up at these meetings are more conservative. So trying to engage the people who maybe aren't speaking because they don't know how they feel, and appeal to them as in the importance of this issue. And then I spoke at the membership meetings quite a bit during the discussion. And then privately, I spoke to friends more on a friendly basis about the importance of being there and voting, and the importance of this issue. So.
Yeah, I mean, it's the same conversation we had earlier, I think, you know, in terms of the progressive docs haven't joined these organizations because we perceive them as conservative, and therefore we've ceded it to them being conservative because we're not members and we're not active. I just got active in my local AAP recently, even though they're relatively progressive. And, you know, I thought, you know, should I do anything with all of these AMA, join the AMA mailings that I'm constantly getting. But yeah, we've ceded it to them.
I think it happens in a lot of organizations that there's a lot of tedious stuff, and particularly if, you know, you're an activist,
Right.
You want to kind of do different things than go to meetings and do Robert's rules.
But it's also, I mean, it's the way these things get captured. I mean, there's a classic example of the NRA actually was not what it is today at one point. It was a much more moderate gun and hunter enthusiast and safety organization, and it explicitly got taken over by a right-wing group that, you know, joined as a deliberate plot, if you will, an organized takeover.
Yeah.
We need to do the reverse to the AMA.
Yeah, I think having some of these national organizations take a position is helpful for people who are scared and don't want to be the first. I mean, the Committee of Interns and Residents just supported it. Corinne, do you have CIR out there?
Corinne, you're muted.
Yeah, but you shook your head no.
Yeah, it does exist in California, but I don't know much about them.
Okay, you know, they just came out in support of single payer.
Not.
Yeah, so nationally, they in fact, they're a good example of this because they had elections that changed over their leadership, and single payer and racial justice stuff was explicitly one of them.
But mentioning that when you're organizing other people,
Right.
is important. I've used the medical society when I organize my town to come out and support. So, and then kind of showing that there's a movement out there, you know, there's the, I always forget all their initials, ACIP, AMSA, Student Medical Association, you know, just the list of people that the movement's growing, and kind of convey, hey, you want to get on board or you're going to be left behind. I think it's helpful each time something like this wins.
I don't know if you mentioned, how many people are members of the Vermont Medical Association?
You know, they say they represent some enormous number of people, like for us, Vermont size, like 2,700 or no, more than 22,000. I don't know, some number that's ridiculous, because at meetings, I would say maybe 250, 300 people come. And it's a general membership. It's not a House of Delegates. It's not any of that kind of stuff. So it's a very different scale. Oh, this is the CIR link that Steve just posted. Yeah, and we didn't, nobody's brought this up in this group, but I did not bring up supportive state single payer, because that's a whole nother conversation. And I was kind of keeping it clean that the Medical Society supports national single payer. Other people may choose otherwise, but particularly in Vermont, where there's something that now is being debated, whether it really is single payer or universal access is on the books, and it's actually a law, but it hasn't been enacted. There were a lot of negative feelings towards that. But even nationally, there's a lot of, you know, amongst progressive national single payer supporters, there's a lot of difference about state versus national, particularly in a small state like Vermont. So whether it can happen. So the resolution I presented was just for support of national. And that's something whoever writes the resolution needs to decide how they're going to go. Because I think the sample resolution, one of the early sample resolutions, and the one that passed in Hawaii, was for state and national.
Well, I am really appreciative of everyone that was able to make it on to this call. We have reached 2 o'clock Central, so we've taken a full hour of your time. And we're so thankful for you being here, Jane. If folks have other questions, they can feel free to email me at caitlin@pnhp.org, and that's spelled Kaytlin. I'm going to put that in the chat as well. I'm using my phone right now. My computer shut down, so bear with me. But thank you all for being here. And do you have any closing remarks, Jane?
I'm very excited to see you all. I get excited when I speak to people about they're doing this. I understand it's much more complicated for a variety of reasons in other states, I think, from what we have in Vermont, whether the size or the culture of physicians. But I do believe that it's extremely important for our organizations to counter what has been the history of mainstream medical organizations, and the messaging of insurance companies and pharmaceutical companies. And it's just exciting to work with the population that I think other physicians that we can make a big difference.